Hi, in this video, I'm going to be talking about joint pain and breast cancer. What causes joint pain and what are some strategies you can use to help manage, and should any additional tests be done? Joint pains are pains in the wrist, elbows, shoulders, knees, and ankles. Other joints in our body can also be included in this. This is separate from bone pain. Bone is sort of in the middle of your arm or your leg and your back. Bones can be obviously in your thighs as well, but I'm talking specifically today about joint pain. The treatment most commonly associated with joint pain and breast cancer are the endocrine therapies called aromatase inhibitors. It's important to know, though, that tamoxifen can also cause joint pain, and I don't want to brush over that. The aromatase inhibitors, the way they work is by decreasing estrogen in your body. Estrogen is sort of a lubricant for our joints, not literally, it's not in our joints, but when we have lower levels of estrogen after our ovaries stop working, or because we're on aromatase inhibitors, it can lead to musculoskeletal symptoms, including muscle pain and bone pain, but joint pain is the most common thing that we see with the aromatase inhibitors. This is a little different from joint inflammation like arthritis and rheumatoid arthritis or osteoarthritis, but it sure does feel the same. My patients have told me I feel 90 years old. Now, I had a 90-year-old tell me that, and I pointed out she was 90, but I've also had younger patients say they feel like they've aged rapidly because of joint pains. It is not possible to overestimate the impact this can have on your life. When do joint pains occur? Well, they tend to start not right away, but they accumulate over the first 3 months of being on an aromatase inhibitor or tamoxifen. And people will often forget when they started on these medicines that they were told this was a side effect. So if you have joint pains and you're on an aromatase inhibitor and you either didn't hear this when you first went on them or you forgot, it's very likely that your joint pains are caused by aromatase inhibitors or, again, tamoxifen. It's worth mentioning that if chemotherapy stopped your ovaries from working, you can have joint pains just from going through chemotherapy-induced menopause. So even if you're not on endocrine therapy, if chemotherapy puts you into menopause, made your ovaries stop working either temporarily or permanent, you may have joint pains just because of those hormonal changes due to chemotherapy. Or if you were on hormone replacement therapy and you stop it when you're diagnosed with breast cancer, you may have joint pains just because you've stopped hormone replacement therapy. The joint pains in your body can be anywhere: hips, knees, wrists, shoulders, or your ankles. And it does tend to be more pronounced on one side or the other. I have no idea why, but I am very accustomed to hearing people say it's worse on the right side or worse on the left side. If it's the same on both sides, that's also quite common as well. And you might notice that you feel stiff when you try to get out of a car or when you get up from sitting for a while. What else could cause joint pains that maybe should be looked into? Well, it's possible that you have an autoimmune condition. You might have thyroid problems. It's not always breast cancer's treatment that causes joint pains, and it's worth talking with your primary care doctor about other tests that could be done to rule out other things that might be extremely treatable, like thyroid problems, for example. What if you had arthritis or joint problems before breast cancer? Is it the case that they will get worse? Well, we tend to think of arthritis as being a risk factor for aromatase inhibitor associated joint problems, but that's not always the case. I've had people with arthritis not get any worse when they start on tamoxifen or aromatase inhibitors, and other people are extremely sensitive to joint pains, so they pay a lot of attention when they start on new endocrine therapy. So what can be done? you're living with this, you want to stay on the aromatase inhibitor or tamoxifen, one of the first things to try is taking a brief break from the medication, seeing what happens. And we found when we had only one aromatase inhibitor available that we could resume the aromatase inhibitor, the exact same one, and people felt better. It's completely inexplicable why that would happen. Why would being on a medicine, then stopping it for a couple months and starting the same medicine not lead to recurrence of the joint pains? We don't know, but it's actually the case that that can happen. The other thing is there are 3 medications that work the same way, and you can switch from one to another and feel much better. So if you're on letrozole, you can switch to anastrozole you can switch to letrozole, exemestane is the 3rd aromatase inhibitor, and you can cycle with all 3 of these. I have found that if people don't tolerate the first 2, the 3rd one doesn't tend to be any better for them, but it's worth a try, other than the fact that you have a 3-month supply of the medicine that you don't want to waste. So, I have had people say, I'm going to finish out the 3-month course, then I'll switch and see how I feel, because these medications can be expensive and people don't want to waste a medicine they have that we know is very effective. So switching from one aromatase inhibitor to another is an option. If you're on an aromatase inhibitor and you just can't tolerate them, try switching to tamoxifen. While we tend to see the aromatase inhibitors as a little better than tamoxifen, if you just can't tolerate the aromatase inhibitor, it's better to be on tamoxifen than none of these agents at all, depending on the stage of disease and your commitment to doing, everything you can pharmacologically with medicines to decrease your risk of recurrence. If you had non-invasive breast cancer or low risk stage 1 breast cancer, this might be worth a conversation with your medical team of, I'm miserable on these medicines, if you are, and would it be reasonable for me to stop taking them? Because quality of life is very important, and this is a conversation you can have with your medical team. What are other things you can do? Well, one thing I mentioned is that people find that if they're sitting for a long time, they feel much stiffer. And one of the things you can do is just try to stay as active as possible. I have a watch that reminds me to stand up once an hour, and if I don't, I get stiff. I'm not even on an aromatase inhibitor. Just finding ways to stay mobile can be really helpful. Another thing you can do is consider yoga, stretching, or other exercise like swimming can keep you feeling much more flexible. Yoga can be very effective, and a lot of my patients actually do stretching or yoga in bed before they even get out of bed, and find that this is incredibly helpful so that they can avoid that stiffness that these medications can bring on in the morning after sleeping through the night. So figure out if you can build in 5 to 10 minutes of stretching and yoga before you even put your feet on the floor. I have lots of people who find swimming is extremely helpful in keeping them limber and staving off the aches and pains that they experience. Some people find glucosamine chondroitin to be helpful. In randomized trials, the results are mixed. So some studies have shown it to be helpful and others have shown it not to be. So don't feel that you're doing something wrong if you take them and they don't help. And certainly it's worth a trial of glucosamine chondroitin to see if it might help. Other things that are effective for some people are Tylenol or non-steroidal anti-inflammatory agents. I have to say I hesitate. Here we have put you on one medicine and now you have to take yet another medicine to be able to tolerate it. So we do try the non-pharmacologic approaches, non-drug approaches to helping you manage the side effects. I hope this has been helpful to you. If it has, click like and subscribe. Drop a comment below if you found something to be helpful I haven't mentioned. It's hard to remember absolutely everything that I've been taught, so contribute below to the Yerbba community. You can follow us on Instagram, and as always, go to yerbba.com to get your personalized report.